Remember, nobody likes coming to the doctor. After COVID-19, there was really a whole lot of misconception, a lot of mistrust in the medical community. People tend to be very distrusting of physicians.
Hello, revolutionaries, and welcome to the Midlife Revolution, the show for busy, empowered women ready to transform their lives. I'm your host, Coach Angie, and today we have an incredible guest joining us, someone I truly admire and consider one of the greatest in her field, Dr. Andi Coleman. Dr. Coleman is a gynecologist and obstetrician and a powerhouse in women's health. And I personally believe it's a true blessing to be called to help bring life into this world. Her passion, expertise, and dedication to her work are unmatched. And I couldn't be more honored to have her here today to share her story and wisdom with us. So let's get to know her further. Dr. Coleman, welcome to the show.
Thank you, Coach Angie. Thank you so much for having me, and thank you for your very kind words.
Of course. So we're just going to get right into it. What inspired you to pursue a career in obstetrics and gynecology?
Well, I'll tell you, I wasn't always 100% sure that I would be an obstetrician gynecologist. I always knew I would be a physician, but I didn't quite know what type. And I'll be honest with you, when I was in medical school and doing my clinical rotations, during that phase, you rotate through different areas to figure out what may be a fit for you. And I saw even back then that making a decision about a career choice had to be something that was strategic if it was going to be something that was going to impact your life and your career for the rest of your life. And my first love was doing surgery. But when I looked at, the field of general surgery and even orthopedic surgery and most surgical subspecialties, I mean, I graduated from medical school nearly 35 years ago. Those were, male dominated, good old boy networks, that were referral based specialties. And the last thing I wanted to do was to go through 4 years of expensive medical school training, an additional 4 to 5 years of residency training, possibly fellowship training, and then not be able to feed my family because I wasn't getting referrals because I was a woman. So even back then, I had to look at what the trends were and decide what's the choice that's going to work best for me, give me the ability to still perform surgeries, do what I love, but also, solidify and control my future. I did not want to be in a male dominated specialty where I would have to worry about other doctors sending patients to me. Well, as an obstetrician gynecologist, I don't have to worry about that. I still get to do complex surgical procedures and I can be as busy as I want or not as busy as I want because I'm my own referral base. My referral comes from the care that I provide for women and their families. And, I'm just happy to say that since my career, I've taken care of, thousands of women in the Metro Detroit area and delivered thousands of, Metro Detroit babies. And I couldn't be happier.
That's amazing. But listen, like I said, I believe you're the GOAT. To just be able to do that, to bring life into the world is just amazing to me. No matter how you ended up at this place, you are at this place and you are impactful and you're impacting lives. I'm sure that you see lots of the kids that you brought into the world now are probably young adults.
They are. And I'll tell you,
Yeah.
it's very satisfying when I see them because I see them all over the place. I see them everywhere. I can't go anywhere hardly, honestly, without seeing a patient that I've cared for or a child that I've delivered. I had a patient come to see me just the other day and she says, Dr. Coleman, I think you've delivered almost all the people in Detroit. Everybody says you're their doctor. And I'm sure that's not actually true, but I do have a very, 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 very large following in the Detroit community. I've been committed to this community for my entire career. I'm very, very happy with the choice that I made. And honestly, God was a huge part of that, moved me to know that this was where I was supposed to be. And He has made this just, I couldn't ask for a better career or an opportunity to give care to so many people because they give a lot back to me as well.
Amen. That's amazing. Well, can you share a notable success story from your practice that had a profound impact on you?
Well, there've been so many. There've been so many. whether it was, the mom who had several early pregnancy losses and we were able to finally get a successful pregnancy for her, or the patient who had spent tens of thousands of dollars on IVF and finally, said nothing's working. And she came to me and got her pregnant and she has a healthy baby who's 10 years old today. I still keep in touch with those patients. But I think the most profound thing in my career has been, my ability to just, educate, impact, and provide a resource for younger women who aspire to do something different. And so my practice allows me to have that type of outreach. It lets me be able to see my 14-year-old patient who came in as a 14-year-old pregnant. And this child told me then she wanted to be a doctor, and she did it. At 14, having a baby at 14, she went on to become a physician because she had folks around her who encouraged her and believed in her, and I was one of those folks. So that's probably one of the more impactful things that I've experienced in my practice. Although there's been a lot of them.
I'm sure. I'm sure. Can we talk about some common misconceptions, especially as we talk about a 14-year-old that came into your office pregnant and now is a physician? But as a 14-year-old, I'm sure her world was just, oh my gosh. Thankfully, she had a loving support system in that. But what
Yes.
are some common misconceptions about women's health that you encounter?
Oh, there's so many misconceptions. Education is a huge part of what we do.
Mhm.
There's just so many, and not just in women's health, but in medicine in general. People tend to be very distrusting of physicians. In general, they are.
Mhm.
So and that's why I'm a huge proponent of patients being very, very comfortable in that relationship. And a lot of times,
Mhm.
that comes when when you're taking care of people or being taken care of people who have something in common with you. There are lots of patients who will say to me, "Oh, Dr. Coleman, you treat us like you're our you're our aunt, or you're our big sister, or you're our cousin. You have to relate and find some common ground and some common interest to let folks know that you're not just seeing them." Running in a room to hear what they've got to say just because you're a doctor, they're a patient. There has to be a connection. So
Mhm.
when you have a connection with patients, it helps you to get past and alleviate some of the common mistrust that we see.
Mhm.
After COVID-19, there was really a whole lot of conception, a lot of mistrust in the medical community, and we had to do a lot of work to convince patients that look like you and me that it's
Mhm.
okay to receive a vaccine if it's going to keep you healthy and keep you safe. So, I think that the misconceptions are many in women's
Mhm.
health in particular. They're varied.
Yeah.
The biggest one is that folks feel like they don't have to, come to the doctor and have, regular checkups, that they don't have to
Mhm.
do regular breast exams, that they don't have to have pap smears and, check their blood work and eat healthy and things of that sort.
Mhm.
So the misconceptions are many, but I try to just meet that patient where they are, to find out how I can best educate them and support them.
That's amazing. And you brought that, since you brought that up, I was going to ask about the frequent mistakes that you observe that patients make regarding their reproductive health, but you just kind of put it out there that they're distrusting. And because of that, they don't come for their regular pap smears and regular breast exams. And are there any other mistakes that you may observe besides that?
Well, those are the big ones. The big
Yeah.
ones are just not getting care. And a lot of times that stems from having a negative, interaction at some point or negative experience with a physician, and
Mhm.
it just makes them say, well, why am I doing this? So it's important to seek out folks who you have some sort of a connection to and some sort of an interest. And physicians that's a very significant relationship. I have generations that I take care of. I've got several
Mhm.
families where I take care of the mom, the daughter, the granddaughter, even the great granddaughter. I'm now delivering babies that I've delivered, so that's quite humbling. And their moms will say, "You delivered her. I'm not letting anyone else touch her." So I have several of those where that happens. So again, I think it's just building relationships, just as it is with anything.
Absolutely. I wanted to move to the current trends in women's healthcare. What are the current trends right now that you find more promising or concerning?
Well, I think, when you talk about, luckily for us, Michigan codified Roe versus Wade, so abortion health is safe in Michigan, and
Oh,
that's a really
awesome.
big deal. Women should always have the right to choose and decide when and if they want to have a
Absolutely.
child, and how they want to have a child, and who they want to have a child with, or if they don't want to have a child.
Absolutely.
The thing that's most pressing right now is that, women, that we preserve that right. I can't tell you what it must feel like for my colleagues who are put in a position to not be able to take care of women who need to be taken care of. The laws and the rules are being made by folks that just don't understand. When you have a
Yeah.
miscarriage and your baby's already no longer living, but you're bleeding out, the only person that gets hurt in that situation is the mother carrying that baby. There's no life to kill. There is no baby that you're getting rid of. So, that's the most pressing thing right now. And in my mind, preventive things are what they are. But when someone tries to prohibit and inhibit your ability to receive care, I think that that is just the most pressing issue that we face. And while we may be safe in Michigan, until abortion rights are safe all over the country, I still feel that none of us are.
I agree. And I'm so happy that our state has stepped up, just abolished that because I don't know. Yeah. That's a whole nother
It's a very
conversation,
big deal.
right?
What you're going to start
Yeah.
to see is doctors who can't perform abortion services and a full scope of service for women, they're not going to stay in those states at all. They're not going to practice
Right.
there. No one's going to move to a state where they can't provide that service. They're not going to move to a
Yeah.
state where their hands are tied in their ability to care for patients. They're not going to do it. So what you're going to see is that women are going to suffer in general. I do work
Mm.
outside of my work in the Detroit area. And I'll tell you, sometimes I'll go to areas that are majority Caucasian and they're rural and they don't have doctors. So I will go up to help out because they don't have doctors, and they don't have doctors because people aren't gonna, they're not willing to change so many of their lifestyles to accommodate folks. But when you add in the fact that they're going to tie a physician's hands and tell them what they can and can't do, you're going to see that those patients in those states are going to suffer greatly. Not only the women who are seeking abortion services, but even the ones who don't need abortion services because they won't be able to find providers.
It's very concerning, and all we just have to pray and just be glad that we are in a state that does not have that problem, does not have that issue, and we can take care of our women. So as
Yeah.
we're talking about the trends and what's going on with that and other things in women's health, something I've noticed in my work as a fitness coach, where I focus on helping women 35 and older prioritize their health, is how much their physical fitness and mindset are interconnected with their reproductive health. So a lot of women come to me expressing they want to reclaim their sense of vitality because they're struggling with changes brought on by menopause or postpartum, transitions, and they're looking for practical solutions that don't feel overwhelming. And they're trying to avoid the frustration of the quick fixes that don't last, which I
Right.
love that, right? But from your perspective, how do physical and mental health influence a woman's overall reproductive health journey? And how can
Well,
professionals like you and I collaborate to support women more holistically?
I think it's more than just their reproductive health. Stress, unhealthy lifestyle changes, they can impact negatively your overall general health. So when that happens, of course, it affects your reproductive health. Being overweight is a risk factor for endometrial cancer, somewhat of a risk factor for breast cancer. So, all of these things, a lifestyle, the body is so interconnected to our brains and to our physical beings that when we neglect any part of our beings, some other part of our being will be affected. So it's all interconnected. I'll tell women who have problems with heavy menstrual cycles or irregular bleeding, typically, the first thing I look at is that they're about 20 to 30% heavier than they should be. So I talk to them
Mm.
about, diet modification and lifestyle changes, exercise to help them get to those goals so that they can maintain a healthy menstrual cycle, so they can maintain or achieve a regular menstrual cycle, which is difficult to do when you're, severely overweight. So we know that diet, exercise, physical fitness is very much so tied to your reproductive health. It can affect your menstrual cycles. If your menstrual cycles are off and they're not regular and they're scattered, it can affect your ability to to conceive. So
Mhm.
it's all interconnected.
It is indeed. I agree totally. As we talk about that, in particular, what in your opinion, what aspects of women's healthcare need more attention or improvement besides, of course, well, what we were able to be successful at, which is keeping abortion rights here in Michigan? What other aspects need more attention or
Well, I think,
improvement?
I think self-care is a lot, for women. Most women don't see that as a priority because they don't have the luxury of seeing it as a priority. Most women, especially in this community, are, primary providers and caregivers and the like. So it's hard for them to get up and maybe get to the gym or, taking the time to get enough rest or sleep, because they're caring not just for themselves but for others. So I think that self care is has to be made to be a large, proponent of women's care. Self care is vital, and a lot of times when you internalize things and you don't understand or realize or recognize how much stress you're carrying, stress will eventually take its toll on your health through cardiac disease and even mental disorders, anxiety and depression, and all of those things come out of neglecting your own physical self care.
Yeah.
We're always
And when
running.
you speak to
We
your
always got to do something. We're always responsible. We always bite off more than we can chew. We're
yeah,
always doing this all the time, and I'm guilty of it too. I'm very much so guilty of it. We often don't tell folks what we need and what we expect, and we just keep rolling with it, keep going with it, keep going with it.
yeah,
And we've got to learn to figure out how to take a little bit of time each day that's just for our own physical and mental wellness and well-being. Easier said
completely
than done, for
agree.
sure.
Easier said than done. I'm very
Hmm.
passionate about that part of it though, because it's really more about time management, right?
Absolutely.
And what's, prioritizing yourself. Where do you
Right.
fit in all of the things, right?
Right.
Can you speak to us about the common mistakes patients make and elaborate on these and how they can be avoided?
I'm not sure if I would really categorize them as mistakes. It's probably more patients just being uninformed and not taking the opportunity to inform themselves or to be educated about healthcare needs, resources that are available, preventive care, things of that sort. So I'm not going to say that it's actually a mistake. I just think that it may just be
Mhm.
that patients are uninformed and unengaged regarding their healthcare.
Okay. That makes sense. That makes sense. Now, for you and your personal practice with your personal patients, how do you ensure that your patients receive comprehensive and compassionate care? I know that you're a compassionate person. How does your patient feel that from you?
So we just talk. I start every patient encounter asking them why they're there, what the reason for their visit and how I can help. So you have to give them an opportunity to express what their concerns are, and then you try to address each and every concern, making sure that you provide an environment where that's not rushed, where they don't feel like, oh, I gotta, get everything that I need to say to you out in 2 minutes because there's another
Mm.
patient waiting. You just have to
Oh
really
gosh,
build a
yes.
rapport with patients and make sure that you're meeting them where they are and hearing why they're there. I mean, remember, nobody likes coming to the doctor, even if it's for, a preventive type exam. It's not the funnest thing to do. So, as a provider, I have to remember that when patients come to see me, it's not necessarily because they want to. It's because there's a reason for it, and there's something that they need, and there's a reason that they're coming. So you have to really make sure that you engage that patient and make sure that they feel comfortable sharing things over and above what may be the stated reason for their visit. So, I talk to them about their work life balance and their family life, and, if there's anything that bothers them, how are they coping with the world feeling completely out of whack right now. I talk to them about those things because, as a female provider, there's certain things that I also, deal with that gives me a little bit more insight into, what my patients may feel. So I'm
Right.
able to meet them there and just provide a safe space where they feel that they can communicate and talk and ask questions and get the things addressed that they want to be addressed, that they think are, that they need and that are important for them.
Yeah, and I love that. I love that so much because you're right. When we come, we need our physician to be focused on us and our needs and especially with what you do, OBGYN, that's so sensitive,
Pretty
We do
personal.
not want to open legs and feel coldness.
Exactly. Pretty
And
important.
it's just
Pretty important.
it's nerve-wracking. It's a nerve-wracking visit always. So especially as you get older,
Yeah.
But I want to know, what advice would you give to someone aspiring to enter into the field of obstetrics and gynecology?
Well, the first thing I would really ask them is, why they want to do it. I mean, it's not an easy profession.
Mhm.
It may appear to be glamorous or, oh,
Mhm.
she's a doctor, but
Mhm.
my life hasn't been my own life for 30 years. I'm on call all the time. Patients call my cell phone, they call my office. When I'm not in the office, I'm on call. I'm getting called in at all times of the day and night. I enjoy the times when I'm not on call, but when you're tied to your practice, you're always on call. So I would ask that person, are you really ready for all of this that it requires from you? I mean, it's a very selfless profession where you have to be willing to give up quite a few things, including time with your family, time with your friends,
Mhm.
vacation time, because your patients become pretty much priority. It's a lot
That's
to
very
do.
true.
So I would encourage anybody who wants to, or who's thinking about this profession or this field specifically, to really ask themselves why. It's a calling. It's a total dedication if you do it right. So
Yeah.
it's a total dedication to your craft and to your patients. So I would say just be sure that you're really ready to give all that's required to be effective in this job. It's a lot.
Yeah, I think that's very sound, amazing advice because you do. I mean, I I can completely understand how you would have to be a selfless person, like you said, on call all the time because you might think the baby's coming one day and it's coming another, and you can't plan a trip around that. You know,
Right.
you can't plan family outings around that. So
Correct.
I bow to you in
Mhm.
what you do, and you do it with such grace. I'm sure your patients are just ecstatic. Like you said, you have a ton of them. They love you. Their kids love you. The ones and their kids love you.
Mhm.
Generations of
Generations,
people.
yeah.
Yeah, and I think that is just so awesome. So let me ask you this. What are five essentials you believe are crucial for a successful medical practice?
Well, I mean, again, you have to do it for the right reason. You have to be about community. You have to show humanity. You've got to have a spirit that leads you to want to be good to other people, and you
Mhm.
have to listen. So I would say effective communication, being in the profession for the right reason, with a desire
Mhm.
to make a difference and make a change. Um, those are the key ones. I'm not sure if I listed five, but I would say that those would be the bigger ones.
Yeah,
You
yeah,
got to be able to
that's fine
communicate
if you
and
didn't say
listen.
five.
You got to care enough to be concerned about what they're saying to you, and you have to understand that the patient physician relationship is a collaborative one. It's not one where I tell the patient, you do this. I need to
Yeah.
meet them where they are and understand why they're not doing the things that they should be doing for their health and try to figure out how to get them
Mhm.
there.
I love that. You go deeper, and a lot of patients need that again because it's so sensitive. And yeah, and everyone's not able to discuss what they're really, really, truly feeling. So I love that. Thank you so much for your service. I have one last question for you before we close. What are some red flags that patients should be aware of when choosing a healthcare provider?
There's only one big one for me. If provider gives you a visit that's rushed, they don't listen to you, they
Mhm.
don't hear you, they don't talk to you, then that's probably not the person that you want to, try to have that relationship with. An OB-GYN relationship is a very personal, intimate one. So it needs to be somebody who's going to talk to you and listen to you and hear you, meet you where you are. If you
Mhm.
feel that your questions aren't being answered, or you're being pushed to the side, or your concerns are being poo-pooed, or
Mhm.
washed away, or it's not a big deal, probably not where you want to be. No, no,
Completely
no,
agree.
no competent, um, confident physician should ever be offended by a patient who asks questions. Ask, ask me questions.
Yeah.
I've had patients, question me about things, and some inappropriate, some not inappropriate. But, I'm always okay with that, because if you're not comfortable with what I am providing to you, I encourage you to get another
Mhm.
opinion, and you'll see that when it's all said and done, you're going to come back to what I said, because you're just
I
going
love
to.
that.
But they've got to have the ability to listen, meet the patient where they
Mhm.
are.
I love
Yeah.
that. I love that. I think we've all had experiences where, the visit was rushed.
Hmm.
And I think that goes back to what you were saying about distrust. After you have enough of those experiences, you start to just be like, well, why go? you
Right.
know and so thank you again so much for your service and being so gracious, and just being a light for those women that are entrusting their health to you.
Yeah, I tried.
Thank you for sharing your insights and experiences with us today. Your dedication to women's health is truly, truly, truly inspiring. And to our audience, thank you for tuning in. I hope you found this conversation as enlightening as we did. Until next time, Coach Angie out.